Hello, everyone, and welcome to another episode of the Think Oral Health podcast, where myself, Maria Filipova, and Dr. Jonathan Levine explore the connections between oral health and overall health. I couldn't be more pleased to welcome our guest, our conversation partner for today, and I couldn't be more pleased to say hi to my partner in crime and co-host, Dr. Jonathan Levine. Hello, Jonathan, and hello, Wardah.
Hi, Maria. Thank you for having me here.
Hi. All right. I'm very excited about our topic today. Maybe I'll do a quick intro for our guest today. Dr. Wardah Inam is the co-founder and CEO of Overjet. This is the leading provider of AI technology for the dental industry to help improve patient care. Wardah has background in product development, and she is what we like to call serial entrepreneur, having led product development in another healthcare startup before. Her expertise is biomedical imaging. She earned her postdoctoral. She was a postdoctoral fellow at MIT, the Computer Science and Artificial Intelligence Lab, where her research really advanced the field in biomedical sensing using machine learning on wireless signals. She's very well recognized and earned multiple awards, including for her work as her PhD showed from MIT, where she developed AI-powered microgrid technology. I could go on and on and on, but we're so excited to have Wardah with us today and to talk about AI and the exciting developments of AI in dentistry. So, Wardah, welcome.
Thank you.
Very exciting. So, maybe I'll kick it off. So you're running this phenomenal cutting-edge research in biomedical imaging, in wireless signals. Walk us through the path or the journey from a postdoctoral fellow at MIT to a healthcare startup to oral health. How did that confluence of cascading miracles happen?
For me, I like to solve important problems, or what I feel are important problems to solve. And that's how I've been driven since a very early age. And in this case, I was working on MRI data and making that more quantitative, faster to acquire. And that's when I changed my dentist and got a new treatment plan from the new dentist, and which was very different than what I had received before. And that was where I got interested in dental diagnosis, where I asked for my x-rays, started reading Dental 101, anything I could find online. And from that, I realized that this was first a fascinating field in terms of how complicated things were, what the technology that was being used, and how difficult a dentist's job was to utilize by using this technology, being able to provide good diagnosis. But then, more importantly, it felt like a societal problem where more than just the problem I had faced, there were people who didn't have access to dental care. There were people who were getting access to dental care but did not trust the dentist in some ways and needed more information and understanding. There were policies being defined that did not think that could not take in value-based care or other initiatives in mind. So that's how, for me, it was complicated enough that I felt that I could be involved in it for a long time, because I feel anything you do, you want to do it for at least some amount of time to be able to have the impact, as well as you could actually have really impactful outcomes here, because where we were starting off from, there was a lot to be done.
Yeah. It's always a personal story, right? You going to the dentist, giving you a completely different treatment plan for the same mouth and the same patient. And so when did you know that you're onto something? When did this become like from a curious rabbit hole of why this is happening to me as a patient to, wow, this could be a business opportunity here?
So I think for me, I actually, once I got more obsessed with dentistry, what that means is I was reading everything I could find. I was watching everything I could find. I wanted to just shadow dentist. That's I was that's what I wanted to do. I quit my job, and not knowing that this could be a business or what I was doing, I started shadowing dentists and trying to meet as many dentists I could to figure out exactly what we were doing. I don't think there was like one moment that was like, oh, we made it, or if there's something, that this is going to solve. For me, it's been this continuous journey of like, I was first curious, then, more involved in trying to figure out what we could do to help improve patient outcomes. And then it became, a project, and then it became bigger and bigger. So I don't think there was one moment where I felt like, oh, we're onto something.
Yeah. Interesting. I like the word that you used, obsessed. That's a very common theme, Jonathan, between all our entrepreneurs, right? When was the last time you were obsessed about something, right? Some of your projects, that's what really gets you going.
Yeah, no, that's right. The obsession and tenacity merging with curiosity and throwing a big dose of humility and a high level of competence, and you start having an entrepreneur that's going to move a needle. So let me ask you, you went from an idea and really solving what you saw as a major problem, which, as a clinician and as an academic myself, realizing that if we asked 5 dentists looking at a full series of x-rays, you might get a number of different diagnoses. What did you say to yourself? Say, well, knowing what I know about technology, and let's call it, let's just say it's the new technology and machine learning and AI, where did you see the opportunity? Unpack that for us.
So I think, this was an interesting time. This is basically 2018, where you've had the introduction of transformers, and you have computer vision advancement happening. And I would say in computer vision, in AI, I think it saw the first development to the point that we were able to get at the level of or start to exceed dentist level or human level accuracies. And because of that, so there was a very interesting time in terms of technology that was there to actually help humans. Because before that, if you've had previous, say 10 years ago or so, the technology just wasn't there. You could work on AI, but it wasn't. It was a research project. It wasn't actually impactful enough in the real world. So the technology was there. Also, the second piece was I watched a documentary. Was called Dollars and Dentists, and it talked about the entry of private equity in dentistry and how the dental landscape was changing. So those two things, I think, really played a role in my thinking of like why it should be now rather than later, which was, hey, the technology is advanced enough. Also, the industry, if we do not introduce ways of measuring quality of care, measuring outcomes, measuring clinical care, people will not have the tools to actually build organizations at scale and really actually promote quality of care as well. So I think those were the two aspects combining, which led me to say, hey, it needs to be now, and I need to leave my job to do this.
And Wardah, you used an AI term around transformers. So for our listeners, could you explain why transformers are, as part of the natural language processing AI models, are better suited to tackle some of the problems that dentistry has versus other technology and other AI? Because a lot of people think about AI as this monolithic thing, but there's multiple models that are underneath that category, and transformers was an important part in terms of the technology evolution. So why were they better suited than other natural language processing models, for example?
So I think so. This was research that happened, and there's background behind before the transformer model got created as well. It happened at Google, and Ashish Vaswani was leading this effort. And it basically, I would say, the paper itself was called Attention is All You Need. So it was around how the attention mechanism leads to really great outputs, but also they really simplified the architecture as well. And I think what that ended up doing was like having similar, people you could be in computer vision research and do natural language processing as well. So these were divergent fields before, and now you actually started having models that you could utilize both, which we actually utilize. We actually do computer vision and natural language processing. So that was one, but also it was just we could also have more context. You weren't learning without context as well. So that was one of the things that I think it just ended up getting to a point that in the end, what we cared about was accuracy, right? Like where the accuracy was improving significantly by these models, and also I think the one more fundamental thing about transformer models was the fact that they really utilized the GPU architecture effectively. So you could parallelize a lot of things. So you could, again, get really good outputs effectively as well.
That's right. So faster compute, convergent models coming up with more accurate, quote unquote, accurate models. So I'm going to channel Dr. Levine here. How do you measure accuracy and quality in care and in also in models, in AI models?
So I think there's what happens in model development, and then there's what happens in, for example, if you're getting FDA cleared, so the clinical studies. So during model development, there's the sensitivity, specificity metrics that are being utilized to actually measure accuracy of the models. However, the way we do it is first, we get to the right metrics that we've set for ourselves, which we determine by what is human level accuracy. Human level accuracy is not 100%, as we all know. So for every output, there might be a different human level accuracies. Say tooth numbers, people are very good at determining what tooth numbers are. Caries lesions, probably not as good as tooth numbers. So that means there's different accuracy levels on what tooth numbers are and what caries are. First, you set those, and then you say, hey, we need to reach or surpass this accuracy. And then once it's done, models or the metrics are achieved. You might have like two outputs or two models where both have achieved that. Then we actually give it to clinicians and say, okay, which one is better? So like having a subjective opinion on it as well, and getting that, maybe one is making mistakes on things that you should never make a mistake on, and the other is making mistakes, which people will tolerate. So having that subjective opinion is helpful as well. And then, so that happens during training. And then what we do is we have to actually pass FDA clearances. And what the FDA's or bar is not only that it needs to be as good as humans, but their bar is that when humans utilize it or dentists utilize it, they need to be better. So what you need to do is then create a ground truth set of what actually is the ground truth. And then you need to make sure that you're actually showing that not only are these models better, but when humans are utilizing it, they're better as well. And that's the second part of accuracy too, where you need to, and if they're not getting better, then that's a problem. You don't want to put that into market. And for us, we do not push anything into production or into our customers unless it has surpassed that human level capabilities.
Let's go there a little bit. So we know about healthcare, we know about adoption rates, and healthcare, the average, Maria, we always talk about, it takes about 17 years for adoption. Dentistry is probably a little bit longer when we look at the digital workflow and the different technologies we have today in dentistry. What are you finding for adoption, with Overjet and with the AI-driven model that is so relevant and amazing how it can answer these big issues in dentistry of subjectivity and validation and quality of care? What are you seeing from an adoption standpoint on the professional side?
So I think adoption of technology is just accelerating, whether it's in dentistry or any other field. How fast things used to move, that's not how fast things are moving. We can all see the example of ChatGPT, right? Like imagine a product coming into the market and becoming such or being used by so many people this quickly. So I think that's where and I do think of course, like digital extras was an amazing technology, but it was a hardware technology. It had to, like, people had to make these big capital investments to change the product. So first it's the software technology, then on top of it, you have the just the pace of innovation happening. People are more connected than ever. There's social media, there's Facebook ads, there's these conferences that are happening and just growing in number. So I think the adoption is happening faster. So for us, we have two customer segments. We sell to insurance companies as well as we sell to dental practices. On the insurance company side, now we serve 110 million members. So that is, about 50% adoption, if you consider it that way. And then on the practice side, I would say, it's hard to sell one by one to every group, but like we have about 100 plus DSOs that we serve, and then we have the smaller segment of solo practices as well. So I do think it's probably, if we don't have a curve, I hope somebody puts a curve, but probably it's one of the fastest adopted technologies in dentistry.
Yeah. And when you get into these dental practices, even DSOs and the singular type practices, to get the staff to utilize it day in and day out. So it's in the computer systems. The patients are coming through their normal workflow. What have you found, you and the team, the training team, and the people in your organization that are focusing on that? How do you find the adoption of the practice? Because dentistry is so different, right? It's not hospital based, and even the DSOs, most of them are allowing the dental practices to kind of have a certain level of clinical autonomy. So how have you found getting these dental practices, the people, the hygienists, the assistants, in addition to the doctors, let's say, wanting to integrate it? How do you see that happening in actuality? And do you have certain measurements or KPIs against that? And how do you see the future, kind of rolling out for that?
Yeah, so I think that's a extremely important question that you asked, and probably you've hit the nail in the head around the challenges in adoption, which isn't somebody buying the technology. It's actually the change management that needs to happen in these practices for wide scale adoption or significant adoption in these practices as well. So I think in this case for us, what has been very, very important is first the training piece of it, which is very hard if you think about it compared to a normal software where you have one person to train. In a dental practice, you have to train the entire staff, and when you're trying to train the entire staff, that means they need to be present as well. That means everybody needs to be present in the day that training is happening. Then there's a lot of turnover that happens in practices as well. That means new staff is coming in, you're training the new staff as well. Which is something that we measure, pretty effectively, or try to measure significantly as well. I think for us, the training aspect is number one. Then number two is the champion buy-in. So who is the person who is responsible for that adoption? And it actually varies in different practices. It's different. Sometimes, you have a dentist who's very prescriptive on what needs to happen in the practice, but that's not always the case. Then you have the office manager who's leading a lot, in some of the practices and what gets adopted. And then in some others, it might even be, if, the hygienist has been there for a while, they even might have a lot of saying what gets adopted in the practices. So figuring out who that person is in the practice and identifying that person is very important as well. And then the third is utilizing data to understand what is happening across the practices. So we do measure what we call the number of actions in the practice. Then we have the daily active users. So are people logging in and utilizing the product? And then you have the and providing the tools to, say, a DSO to ensure that it is being utilized across their practices as well.
Right. It's so interesting, Maria. There's so much, fragmented dentistry industry starting to have a business model that's growing up and getting more organized. There's so much personal bias with these individual practice owners or these different type of practices. it seems to me, if I would offer up some of my own insight of being a clinician, that the AI reading X-rays needs to be automatic. You take an X-ray, you have an automatic read, and almost the subjectivity of, yes, let's go put some AI on this X-ray, vaporizes. Pans, X-ray, digital X-rays, automatically read by the software, and that number gets right up, in front. And I think when the offices choose to do that, I think that's going to be a good turning point. And it's right. We're kind of getting there. I remember the early days, 3, 4, 5 years ago, of having AI reading X-rays, and hearing some of the comments from colleagues of more of a fear-based conversation than of optimistic, positive one of really having an AI co-pilot helping you diagnose, where I think we're finally getting to today. Would you say that's fair?
I think it's fair. I mean, overcoming the inertia of we've always done it this way, right? It's a big barrier. And also going back to dollars in dentistry, a lot of these practices are fairly successful, right? So if it's not broken, why fix it? Right? I don't have a problem. Why do I have AI? I'm doing perfectly okay with my treatment plans. No one's come to complain. And so from like an individual sole practice owner, the incentive to change or to try something new is minimal. And so that's the uphill battle that Wardah, you and your team and other new technologies out there need to overcome. And so I think slowly, kicking and screaming, a lot of these dental practices are getting moved into the future of dentistry, where dentistry is augmented by technology rather than replaced by technology. And maybe if we pen in on that future of augmented dental care, where do you see AI evolving? Do we see at some point where certain procedures or activities in the dental office, if they're not done with AI first, they're not done up to the standard of care, right? When does AI become the default for certain procedures? Or is that at all the path we wanted to go?
I was just looking up what our numbers look like on the question around adoption. So I think, if we look at any other AI technology being utilized in healthcare, I think our numbers are much higher than that. So, for us, it is 90% weekly active clinic usage, 80% daily active clinic usage. That means and these are DSOs. So that means even if it was a top-down buying decision, 80% of the practices are using it daily, and 90% are using it at least weekly. Might mean multiple days. They haven't used it every day of the week, and there are days where it's Fridays, etc. That might be less usage, or days where we might just be doing procedures and not doing diagnostics. So those are some of the things to put even more caveat on it, because it doesn't need to be used on every appointment as well. It needs to be used when data is being collected and being looked at least currently the way the technology is. I think it'll change very soon, but that's where I think the technology is. So, if you look at it in context, I think it's been adopted in dentistry unlike anything else in healthcare. So, I mean, better adoption in dentistry. But but there is room for improvement, and I think this is one where as these products get more mature, we're going to see an increase in these numbers as well. Now, to your question around what does it look like in the future, I do think in the end, if you have an amazing dentist and they are pretty confident in what they're doing, etc., I wouldn't say it has to be used in every case, etc. And that's just knowing how dentists are. But it is one of those things where as it becomes part of your workflow and part of how you do things, it actually just people get used to it as well. So it is like if you were driving a spell check, for example, when you're doing Grammarly and utilizing spell check, course, you could get all the grammar right if somebody wanted to think through everything and wanted to spell, did not want, and could spell check everything. However, once you start getting used to spell check and Grammarly helping you craft better sentences, very quickly that becomes the default as well. So I think it is one of those things that as the technology improves further and further, we will see, especially for people who like to do an excellent job, to utilize this technology not basically every time, because it's just the way you put it, it's the default. But I don't think it needs to be like enforced on people unless it is providing them value. They are going to adopt it.
And at this point, let me ask you if you believe this is truth or maybe a myth that we need to disperse. Currently, there is a live and thriving discussion around adoption of AI in dental programs where we train the future generation of dentists. And there's a concern, maybe rightfully so, that if dentists are not reading the images themselves, but AI is reading them first, they're not going to be as well equipped as another dentist, perhaps Jonathan Levine's cohort of dentists who didn't have technology to aid them. They had to go through all these images and pattern recognition themselves to create that sense of what's early lesion, what's not. So where do you stand on that question, whether or not AI in training settings in dental schools helps us or deters from the clinical education? And that's a question for both of you. But Wardah, please jump in here first.
I'd say two conflicting things here. So one is the answer that is based on University of Florida's research. University of Florida conducted a research utilizing Overjet, and what they did was they trained people using Overjet, and then some dentists did not have, or some dental students did not have Overjet utilized, and they looked at the accuracy, not only while they were utilizing Overjet, but after the fact. And they found that the students who had used AI to learn were much better at diagnosing. And these numbers are crazy. They are going to publish this study, so I don't want to disclose everything there. But that, and I think the dean has presented as well yet, but it hasn't been, I think, published yet. But there is research that University of Florida did around showing that the students are much better after learning. So, however, the conflicting part is, intuitively, I think once people get used to it, they are, and if we look historically, think about, for example, calculators, right? Like before calculators, the way my dad can do math in his head, probably I cannot do math in my head because I grew up on calculators, and the next generation will grow up with LLMs doing their math where they wouldn't even have to put in the numbers into a calculator. And of course, his math in his head was better than the math I could do, and then the math my child will be able to do. However, was it very important to actually put those numbers? Is it better to get the better results, or is it better for me to put the numbers and calculate it myself? If we look at just how math has evolved as well, of course we are doing things that were never possible before, and we are getting to solving problems that have not been solved in a while as well. So I do think just technological progress is inevitable. It needs to happen, and we just need to evolve and say, hey, now this is something that a calculator can do easily, or say LLM can do easily. How do we get to the next level? How do we educate our students to get not think about the basics, because say the basics will be done. How do we think about, let's put better education around edge cases. Let's think about, backband effects. Let's think about other areas that we can improve, such as a group of people, we do better rather than us versus technology.
Yeah, the dentists of the futures need different skill set, like recognizing what's noise, what's actual AI. LLM hallucinations, all these things are going to have to be part of the skill set. Jonathan,
And
go
that-
ahead. I'm
And
keen
that's
to
why,
hear what you
and that's
think. Yeah.
exactly what you just said and what Wardah just said. And that's exactly why you have to start with the youth, the education,
Mhm.
the dental schools, so that having that AI co-pilot, learning through having that AI and really understanding it, and then taking that out to clinical practice, it just becomes part of the protocol in their system. And it's not surprising, in fact, easy to predict that their capability skill set of reading x-rays is so much higher and so much better. And while we're on the conversation of future, want to take us to the future a little bit. We have digital x-rays. We want to be able to detect decay. We want to be able to detect bone loss. We also want to look at PANS and be able to understand lesions. We also want to be looking at a standard of care that's right around the corner for every dental office. My practice, we're all specialists. We're a group of specialists working together to raise the bar, to keep the highest bar possible for quality of care. When does it go to the cone beams and the CBCTs? So map out a future for us for the way you're thinking about, these issues in dentistry and the quality of care and where you can take your company.
Yeah, so I think at least the development of AI on images is a solved problem. If it hasn't hit the market, it's going to hit very, very soon. So I don't think it's even multiple years. It's this year or next, right? So I don't think that's where the long term will follow, because it is something that the models have gotten good enough. People knowing how to annotate data, how to get the outputs. That whole thing has been streamlined enough that, for example, for us, we can get a new model out in a week or so. Get it, get it through. Then it is the checks and the balances and regression testing and all the things that need to happen, putting those in place. But it is pretty now straightforward, because we've built models with, or more foundational models as well, that can get to outputs very quickly. Now, in terms of, what is going to happen next, I think in dentistry, we've kind of just touched the surface with being able to identify things on x-rays, and then and our contribution to this industry was quantification. We introduced quantification into the market, and I think people followed afterwards, but that was but if you think about it, that's pretty basic in terms of what we can do. I think the next big unlock is going to happen with treatment planning. So how do you actually create treatment plans based on what the user needs are? How do you take in all the information of the patient to come up with a better treatment plan than any, average dentist could come up with? Maybe not a prosthodontist, but like, how do you actually then get to a prosthodontist level as well? But those are things that I think will be the next big unlock. And it's not easy. There's a lot of research going on how do you actually do this well. And then and do it well, taking into account of the entire patient data, not just a single snapshot in time as well. And then the third is like, how do we actually think about outcomes and improving those outcomes as well? We have started work around that aspect too, and we are working with a lot of the different agencies to come up with the right ways of measuring oral health outcomes, and then being able to track those. So I think that's where I feel like a lot of the next advancements will happen to really help dentists provide the best care that they can.
It's amazing.
That's great.
Well, we set an intention at the beginning of this conversation to learn. And boy, have we been learning in the last half an hour or so. Wardah, we're at the end of our time, but before we let you go, one last question. How could our listeners, budding, aspiring AI early adopters, stay in touch and keep up with what you're doing, the research you're publishing? What's the best way for them to get involved and get in touch?
So we have our website, overjet.com or overjet.ai, both lead to the same website. I think that's where we'll find more resources as well as ways to connect with us.
Great. Easy. Well, thank you. Very grateful to have you today. Jonathan, any parting thoughts on this topic?
No, it was very inspiring. And, as we look at the future, and what I think you and your company are addressing some real needs within the industry. As you outlined the future, once we get past this, the quantitative impact that you're having on the industry with reading x-rays, what you pointed out about treatment planning, the subjective nature of it, the complicated ability to put all of those synthesis of the data together and to come up with a plan that integrates the different disciplines, and interdisciplinary dentistry is an area that's really ripe for change and improvement. So that would be quite amazing and very inspiring to hear that you're going to get after that. Very exciting.
Thank you. Thank you for joining us, Wardah. And we'd
Thank
love to have you again with some updates. Sounds like the pace at which you're evolving the product and adoption is pretty amazing. So soon you'll have updates to come back to share with us. So
Absolutely.
extending an invitation to come back and talk to you soon. Thank you.
Thank you so much. Take care.